If you're getting ready for the oral surgery, DHA, or Prometric exam, you've got to understand something really important. This is not your typical knowledge test. It's a test of your judgment, your nerve, and what you do under pressure. So today, we're going to crack the code on what to expect and, more importantly, how to train for it.
So, you've hit the books, right? You feel like you know the theory inside and out. But are you actually preparing for what the exam really tests? Because let me tell you, there's a huge difference between knowing a fact and making the right clinical call when the clock is ticking. And this right here is the fundamental truth about this exam. It's not designed to see how many facts you can cram into your brain. It's built to test one thing: your clinical judgment. Can you make the right call in a realistic scenario with the pressure on? That's what it's all about. Okay, so to pass this thing, you first have to understand the game. Let's dive in and break down exactly how these questions are structured to really get at your decision-making skills, not just what you've memorized.
Almost every question you're going to see is what they call single best answer. They're not going to ask you for some random fact. Nope. They'll give you a clinical scenario and ask for the most appropriate next step. And here's the tricky part. Several of the answers might seem correct, but only one is the absolute safest and most critical action to take right now. For example, you see a patient with facial swelling. Sure, antibiotics are a valid treatment, but the best next step is always checking for airway compromise first. That's the kind of thinking they're testing.
And you have to make these critical calls fast. We're talking 150 questions in just 3 hours. If you do the math, that's a little over a minute for each one. There is absolutely no time for hesitation. Your decision-making has to be sharp, and it has to be instinctual.
But here's the good news, and it's a big one. While all the clinical scenarios are different, the underlying logic that Prometric uses is incredibly consistent. Once you understand this pattern, you can walk into any question with a lot more confidence. And this right here, this is the pattern. Think of it like a mental checklist, a safety hierarchy you run through for every single question. First, you instantly scan for red flags. Is anything here life-threatening? Second, you prioritize the immediate dangers. Think of it as your ABCs: airway, bleeding, and spreading infection. They always come first. Third, don't just order tests for the sake of it. Only choose one if it's actually going to change your management plan. After that, you pick the safest treatment, and finally, you think about how to prevent future problems. You need to burn this logic into your brain.
Okay, so we've got the logic down. Now, let's apply it to the specific topics you are almost guaranteed to see on this exam. Knowing exactly where to focus your study time is absolutely key.
These are the heavy hitters. For extractions, they want to know you can make the right call on impact to teeth and that you understand surgical principles. For complications, they need to see you can handle bleeding, a dry socket, or an oroantral communication urgently. Odontogenic infections are huge. They're testing if you can spot the warning signs of a dangerous, deep space infection. And finally, the medically compromised patient. You have to be able to safely manage someone on anticoagulants or with other complex conditions. Mastering these areas is completely non-negotiable.
Now, here's the thing. Even with all that knowledge, really smart, well-prepared candidates can still lose marks. Why? Because the exam sets very specific traps designed to catch anyone who isn't thinking with that safety-first logic we just talked about. These are the classic pitfalls. A candidate sees a spreading infection and their first thought is an antibiotic, when the best next step is almost always about drainage or controlling the source. They see a patient on anticoagulants and they panic, choosing to stop the medication when local measures would have been just fine. And the sneakiest trap of all? Picking an answer that is a correct fact but isn't the most important action to take in that moment. You have to avoid these traps.
So the big question is, how do you actually train for this kind of test? You can't just read a textbook and hope for the best. You have to practice that decision-making process over and over until it becomes second nature. Think about it. Traditional studying is passive. You read, you memorize. The right approach is active training. It's about working through focused clinical scenarios, not just broad theory. It's about mastering the art of elimination to find that single best answer by applying that clinical logic we've been talking about again and again. And this is exactly why having the right tools is so critical. A resource is only useful if it's built to mimic the exam's unique style and logic. This is where a focused preparation tool becomes an absolute game changer.
So this is what optimized preparation looks like. It uses realistic clinical vignettes that feel just like the real exam. It forces you to use that single best answer logic.
And crucially, the explanations don't just tell you the right answer, they train you in elimination by explaining precisely why every other option is wrong in that specific scenario. It's packed with questions on complications, red flags, and medically compromised patients, exactly the high-yield areas we covered. And you know what? Volume matters. Working through a ton of practice questions gives you the repetition you need to make that clinical decision pattern totally second nature. Every single question becomes another chance to practice identifying red flags, prioritizing safety, and avoiding those common traps.
So, if you're serious about passing, the message is clear. You have to shift your focus from passive learning to active training, and you need a tool that's been specifically engineered for the unique demands of this exam.
I'll just leave you with this final thought. This exam isn't a test of what you know. It's a test of what you do with what you know. So, the real question is, are you ready to train for clinical decisions, not just textbook facts?